Yeah, we've got some very fine health-focused institutions in Ohio and, of course, across the country. What makes Ohio University and the College of Health Sciences and Professions unique, though, is the focus on mission.
I think one of the big things that makes CHSP so special is the diversity of programs that it offers.
In my opinion, what makes the School of Nursing so special at Ohio University is the staff.
I find the Department of Social and Public Health so special for the fact that through it we can work both with the community here in the Hocking Hills and Athens, as well as then having connections throughout the state of Ohio and across the whole world too.
It not only offers clinical programs such as nursing, but it offers public health programs, it gets into athletic training. I mean, it is a full range of health services, and I think that just makes it really unique.
I never felt alone going through that nursing program. I knew that if I was ever struggling, I could go to any staff member's office anytime, contact them any time or day, and they'd be there ready to support me.
You know, the College of Health Sciences and Professions really is the home for the majority of health-focused programs at the university. We've grown from about 2,600 students to nearly 10,000 students across 6 academic departments, and those students are found in all 7 of the Ohio University campuses, as well as through online programs. We've also grown dramatically in terms of our alumni base. When I became dean back in 2009, we had maybe 14,000 alumni. Today we're over 30,000. Every year we graduate a couple thousand more students who go on to be very successful in their careers, and we hope will be very engaged alumni down the road.
There aren't any other institutions around that I know of that have a real sense of their mission, not only to their students and faculty, but to the communities that they serve. And we have so many researchers, practitioners that are teaching students in the classroom doing research and then going out into the communities to be of assistance regardless of, in this case, whatever health issue they're dealing with. And it's a really exciting environment. It's just a wonderful institution. I'm so proud to be associated with Ohio University and the College of Health Sciences and Professions because we make a difference.
My whole research and everything that I've done has been related to rural and Appalachian health. I think one of the concerns I had was the impact that the university could have on the community surrounding it, and vice versa, the impact that the community could have on the university in the public health context. And that means, spreading the disease, and then any kind of preventive activities as well would really take the university and the community working together.
Back in February, Dr. Maroney presented internship opportunity through her connections in the public health atmosphere of a summer internship with Columbus Public Health. After interviewing there, because I was interested, so I went ahead and interviewed with it. And then out of the interviewing process, I was 1 in 3 students that was selected to be the summer internship. However, though, with the changing situation surrounding COVID-19, it took a unprecedented turn, and I was given opportunity then to become a contact tracer through Columbus Public Health.
I was really proud of the way the university, the college, and the Alliance responded. We were contacted very early on by state policymakers and the state response teams to put together volunteer contact tracers, and we ended up, I think, with about 40% of the tracers and over half of the faculty volunteers that came right here from Ohio University.
Working as a contact tracer for Columbus Public Health, I was able to gain a lot of professional skills in terms of communication or teamwork skills of working with people within the field itself. Through that, I've been able to gain connections or potential job opportunities in the future through this incredible experience I was given during these times.
The Alliance itself has been asked to really put together the training curriculum for contact tracing. That was done by our partners at the University of Toledo. And the 5 universities that are part of that learning collaborative are all using one part or another of what that collaborative came up with.
I actually started my job at Marietta Memorial Health System in the end of May. So things were still in the midst of trying to figure out things, and still today information about COVID is constantly changing. So I think what was mainly important for me was knowing how to keep myself safe so that I could keep my patients safe. And that way I could be educated in what I'm telling community members as well, because they're looking at healthcare professionals every day going, what do I believe? What should I do?
We've spent a lot of time trying to understand what the crisis would mean for our students, but also the opportunities that it might create for our students. And the one thing I'm proudest of is the faculty and the staff at our college. They didn't run from the crisis. They ran toward it, and they really adapted how they operated. They really began to think about how they could teach students, prepare students to work within it. The fact that we've had students in our nursing and physician assistant programs actually graduated early so they could go to work sooner.
We, as a university and as alliance partners, are very engaged in the communities where we have campuses, trying to support local health department efforts, whether it's through clinical expertise, contact tracing, just being part of the solution and not part of the problem in a local community. And the local communities have been very grateful, I think, for our efforts, and we've certainly been grateful for them.
Honestly, the whole program prepares you day one to become that nurse at the bedside who's competent and able to care for their patients in a compassionate manner.
You know, we've really tried to come up with an identity that really makes us unique and also highly impactful in the lives of our students. We've really tried to define ourselves around high degrees of engagement, especially with underserved populations. I think we are in an excellent laboratory to teach our students about populations in need. And so if we can get every student out and engaged in our region in a way that they make a difference, I think that's just an incredible learning opportunity for the students. We're a health college where as much learning happens outside the classroom as inside the classroom. We're a health college where students really have a chance to understand the world they'll be going into as professionals and understand how to make an impact and make a difference in that world and the people they're encountering.